All right, I want to start today with the coronavirus update. I think it's useful to do this at least once a week. Last week, people seemed to appreciate it. And because I look at this stuff every day, I assume that everybody has all the same information I have. And we learned a long time ago when we were kids what happens when one assumes. And I don't want to do that. So let's do the coronavirus update. I have cautiously good news about cases and deaths and vaccines, and we're going to discuss the coronavirus variants, and let's get right into it. So first of all, cases. Last week, I told you that after peaking around January 11th, average daily COVID cases were down about 42% as of early last week. And I said at the beginning of last week, by the end of last week, meaning Friday, we would probably be down 50% in terms of daily cases from that peak on January 11th. And we reached that milestone, and we have now surpassed that milestone. COVID average daily cases in the United States are down to 110,000, still an insane number, 110,000 cases a day on average, but that's a 56% decline from the peak on January 11th. So in basically 4 weeks, average cases down 56%, which puts us roughly where we were back on November 10th. And hopefully that will continue to decline. If cases continue declining at the same rate that they have been since January 11th, we'd be down to about 48,000 cases a day by the beginning of March. It's unlikely that this will be a straight line decline. There will be changes, there will be inflection points, but this is a very, very good piece of news. And we will talk about how the variants may affect these numbers. Now, what about deaths? We've previously mentioned, at this point, everybody's probably sick of hearing me say, deaths lag cases by about 3 to 4 weeks. We would expect that if cases peak on January 11th, deaths would be peaking and starting to decline around now. Is that happening? Yes, it appears to be happening. Deaths hit an average peak of about 3,400 deaths per day around the middle of January, more than a 9/11 every single day. The trend line sort of plateaued, and it has started to come down, and hopefully will start to come down more quickly as people are vaccinated, particularly folks at highest risk of death. So that gets us to variants, and to get to variants, we have to go through vaccines. Currently, there are 2 vaccines approved for emergency use in the United States. First was the Pfizer vaccine, then the Moderna vaccine. Early concerns about supply and delivery have been replaced by more cautious optimism from Pfizer and Moderna about their ability to continue delivering millions of doses per day. As many of you know, I was on a sort of on-call list for leftover doses at the end of the day. A friend of mine works at a hospital that has a zero waste commitment on doses. And I was able to get my first dose of the Moderna vaccine about 10 days ago from a leftover dose from canceled appointments. And the numbers continue to improve. The U.S. is now giving out an average of 1.46 million doses per day. Remember, Joe Biden's goal was 1 million doses per day for 100 days. We're at 1.46 million doses per day. And on Saturday and Sunday, the U.S. actually did 2 million doses each day, 2 million on Saturday, 2 million on Sunday. That is absolutely fantastic. If we get a third vaccine approved in the next 3 weeks, Johnson & Johnson has submitted their vaccine for approval. That's a 1-dose vaccine. Not inconceivable that the U.S. could get to 2.5 million doses per day. I mean, I want to be careful, but even 3 million doses per day, which would be absolutely fantastic. And the 1-dose nature of the J&J vaccine makes the logistics even easier. Now, cases down, deaths starting to come down, vaccinations starting to go up. What about the COVID variants? There is a lot of doom and gloom about the COVID variants from the UK, from Brazil, and from South Africa. Lots of people being very dire about this. Some even saying the vaccines just flat out don't work against the variants. So what is the truth? The truth is really not that bad. What we know the AstraZeneca vaccine, which is not even approved in the US yet, really doesn't seem effective against that South African variant. That's bad. They're having problems moving forward. Okay. The Pfizer and Moderna vaccines, which are approved in the United States, seem, the way I would characterize it colloquially, without making a mathematical statement, is the Pfizer and Moderna vaccines appear to be quite effective against the variants, including the South African variant. Now, it is true, early data suggests you are less protected against the South African variant with the Pfizer and Moderna vaccines. It doesn't mean you are unprotected. People, immune responses on a bell curve, as many of you know and we've looked at, and those with a stronger immune response to the vaccines are probably still protected against the South African variant and protected against the British variant, that's the B117 variant, and the Brazilian variant. But very importantly, this is not a reason not to get vaccinated. It's a reason to get vaccinated as quickly as possible. The virus mutates as it spreads. Every time that the virus goes from one person to another is an opportunity for a mutation. The more people you get vaccinated now, fewer cases, less mutation, fewer variants. Okay. Moderna and Pfizer are studying the variants. They are developing, as a sort of insurance policy, a modified booster shot, but that's 8, 9, 10 months away based on my current understanding. So we don't yet know what the approval process will be from an FDA standpoint for modified vaccines. So what we can do now is, there's no point in waiting. If you're eligible for a vaccine, get the vaccine, because if you prevent an infection or 2 infections or 3 infections by being vaccinated, even if eventually the British, South African and or Brazilian variants become the dominant strains, the more people that have partial protection, the better. There's no argument for delaying. There is a debate now about what happens in 3 months. So we've talked about cases are coming down quickly. Deaths have leveled and are starting to come down, but the variants are spreading. There are some, the most pessimistic perspective, who say the variants are going to take over, the vaccines will not work against them, and cases will explode again to the level we saw in December. I don't think that's the most likely scenario based on all of the epidemiological data I've seen and interviews and statements and writing from immunologists and epidemiologists. If we keep vaccinating, the January 11th peak will likely be the final major peak. As the weather starts to improve in the parts of the country that have winter and more people are vaccinated, yes, it is likely true that more and more of the cases will be the variants. But it is also true that more and more millions and tens of millions and hopefully hundreds of millions of Americans will have sufficient protection against these variants that cases will continue to decline. Now, when we get to, then we'll have summer, et cetera. When we get to the next flu season in the fall, hopefully by then there will be a modified booster if indeed it's determined that that's what's necessary. And my hope is, and I believe it's realistic but cautious, is that the January 11th peak was the final peak for this pandemic. All we can do now is continue to be safe, continue to vaccinate. And I've mentioned this before. We should not undersell the vaccine. I know people who are saying, listen, I'm being told, even if you get vaccinated, it may not work against the variants and you still have to wear a mask. You still have to social distance. There are lots of good immunologists and epidemiologists who are saying, listen, in a month, if the numbers continue going this way, if you are fully vaccinated, meaning a week past dose 2, it's a very acceptable level of risk to have an indoor dinner with 6 fully vaccinated people. Let's be realistic about what this means. It doesn't mean you go to the grocery store and you say, I don't have to wear a mask because I'm vaccinated. That's going to be the policy for some time in parts of the country. I know friends in places like Arizona are telling me nobody's wearing a mask at the grocery store. But in much of the country, that's what's going on. It'll continue to go on. But let's be realistic about the game-changing nature of these vaccines. We'll check in about the data again next week. One of our sponsors today is Lucy, and they are giving my audience 20% off. Lucy is a company founded by Caltech scientists with only one mission, which is to help people quit smoking and vaping by offering a clean, affordable nicotine alternative. Now, many of you know, you've heard the stories. I've known several people in my life who have struggled with quitting smoking. I've seen how difficult it can be. And nicotine alternatives can be hugely helpful. Lucy offers a nicotine gum in 3 flavors: wintergreen, cinnamon, and pomegranate. They also have lozenges, which come in cherry ice flavor. Lucy is affordable. It'll ship right to your door. You don't have to go out to the store. Shipping is always free. You can buy single boxes or save with a subscription. It's time to throw the cigarettes away and get rid of the vape, and Lucy can make it easier. You'll find a ton of excellent reviews online from countless people who have used Lucy to quit smoking and vaping. Go check them out at lucy.co. I've put the link right underneath this video, and you'll get 20% off when you use the coupon code Pakman. And just a quick disclaimer, I'm required to give: these products contain nicotine. Nicotine is an addictive chemical.